Well, I think the sheer volume of cases that we're seeing is something that we're all getting nervous about. You know, early on in the pandemic, we made all these plans and we were ready, and you know, people stayed home, and we really didn't see the surge that we were really worried about. And now, you know, my entire ICU, which is full of normal patients on a regular basis, is now caring for critically ill COVID-19 cases. And it makes us nervous about what's ahead. Yeah.
Would you say you guys have reached capacity?
We're certainly, I know the institution has done things so that we have kept beds available. And I can't speak to all of those things, but we have moved patients out of our ICU to other ICUs in order to make space. And I know that they have made adjustments to surgery schedules in order to not have potential ICU patients coming and needing those beds.
On any given day, how many COVID patients are you caring for versus like general population in the ICU?
Well, in our particular ICU, both of us are only caring for COVID patients right now.
That's right.
We are both trained in an ECMO specialty, and so those are patients who require kind of the most intensive care you can get. And right now, those are our COVID-19 patients.
Would you say that they're not as, like what I'd heard kind of lately from healthcare systems was like the acuity was a little bit less than early on in the pandemic because of treatment? Like you're not needing to put as many people on ventilators. Is that true?
You know, that has not been my experience. We only see the sickest of the sick, and you know, in my personal, what I'm seeing is that we had some really good successes early on in the pandemic where our patients were leaving the hospital and getting better, but the patients that are making it to my unit that I'm caring for are sicker, are having more of the confounding complications like bleeding and, you know, massive blood clots and heart failure associated with their COVID pneumonias that are leading to worse outcomes.
Worse outcomes than like earlier on, maybe.
And earlier in our ICU, you know, in my experience.
And who is this like impacting most? Are you seeing just across the gamut people getting so sick from this? It just picks and chooses?
It's really, really distressing in that we don't know who out of a family member, you know, we'll have a patient come in who's was exposed, say, at a birthday party, and the whole family, except maybe a couple, will develop COVID, and one or two will become critically ill. And sometimes it's someone in their 20s or their 30s, or sometimes it's someone who's pregnant, or sometimes it's, you know, the grandma in their 70s. We just don't know, and it's really it's distressing because we have no idea who's going to end up in these critically ill situations.
I mean, you are literally on the front line, like you are dealing with these people every day. What is that like for you?
It's exhausting. It's really hard. You know, professionally, there's this whole new layer of between us and our patients. You know, I've got a P100 on my face. We've got a face shield that's been cleaned off and, you know, is streaky, and, you know, we're in full gear, and, you know, trying to communicate with our patients and, you know, provide them the best care that we can with all, you know, they've only seen my eyes. And we're also in the critical care unit really used to working with patients and their families, right? Because this is a traumatic experience for families. And it's been really challenging to support families in that situation too, because they can't be at the bedside. And if they are at the bedside, you know, they're looking at their loved one through a glass. And they're, you know, recently I've been helping families who are outside the room, you know, holding the telephone up to their family member's ear, who often can't respond to them because they have a breathing tube in, or they're sedated so that their oxygen levels are stable enough, just so that they can hear a familiar voice. And that is such a challenge. You know, we're so used to being in these sacred spaces between life and death and at the end of life. Oh, it's such an honor to be in that space. But it is very, very distressing to not be able to provide our patients and families with an important part, which is like allowing them to be part of or present, more present for those experiences, you know.
That's awful. That's awful. Everyone's so isolated. It's so unnatural.
It feels so unnatural, and it goes against every part of, you know, it just breaks my heart, is the simple way to say it, for these families and these loved ones who are, you know, at best, we get to bring families to their bedside as they say goodbye. And at worst, it's, you know, like we're doing here over a computer screen. I think, you know, with my husband and I, we have two little girls, so we work opposite days. We both work in the ICU, and so we, you know, when we're home, we're like, we have to be full on in, you know, mommy or daddy. And it's been a real struggle, you know, because to keep those separate, right? When you're so taxed at work, to come home and really find a way to shed that, that piece, so that our kids can have, they don't have to feel it, you know? So that's been a personal struggle for us, and I know many healthcare workers. And, you know, we also worry about bringing the illness into our home. And now we feel, after months of dealing with this, we have PPE. We feel very confident in our ability to use that. We know that we haven't been exposed, at least the two of us haven't. And we have a pretty strict routine of, you know, how we change at work and what we don't bring home, and, you know, how we go straight to the shower before anybody gets any hugs or kisses. And we are so conscientious about how we live our lives outside of work. And it's very isolating, but it's just been, we have to focus on what we can be grateful for, you know, that we get to have a job that we love and do the best we can to provide support and care for these patients and their families in the way that we know how. It's nice to feel community support. I also hope that they support us by staying home. And I know it's hard. We're all so tired, you know, it's hard. But I hope that they understand that these little actions and decisions and choices that they make in these coming days and weeks about whether to get the family together or whether to expand their bubble just a little bit for these celebrations that we love, you know, that the impact could be devastating. It could be their loved one in my ICU bed that I have to take care of. And you just don't know. You just don't know. The numbers continue to rise, you know, healthcare workers like myself, you know, if we have to be at the hospital more, if we are continue to be max, like we have to make really hard choices in our own lives. And one of the things that we have been struggling with is what we do with our kids if we feel like it comes to a point where we can't keep them safe. And, you know, that includes potentially sending them to live with a relative away from us. And so stay home, please.
So sorry. Wow. Yeah, I mean, it's got to be really, really hard to, as people were calling you heroes early on in the pandemic, kind of not equating that with, hey, your individual actions are impacting these heroes, these people you say you respect and admire so much, you're actually burdening them and overwhelming them right now. You know, we got to go back to that.
Yeah. And I know we're tired, but, you know, I'm so hopeful that, you know, we have news of potential vaccines. And so I'm hoping that people can find that kind of drive in themselves to really think about how they want to care for their community. And, you know, everyone I know, you know, has a community that they care about and wants to do what's best for them. And right now, if we can make those hard choices, you know, we may not be in this situation for the next holidays. And those people that they love and care about will be with them there.
If the surge continues and if people do gather on Thanksgiving, what are you kind of most worried about as a nurse on the front line?
I'm worried about not having the resources to take care of all of these patients. You know, they are so critically ill, and you know, we're taxed. We're working so hard now, and as beds fill up, we have contingency plans. We do, but those, we'll do the best that we can, but it's not going to be like the care you would get today, because there just won't be enough staff to do that. And if you get in a car accident or you have an MI completely unrelated to COVID, you're still impacted by that because of the beds, because of the staffing. And so it's not just about people who get sick with COVID-19, it's about everybody who needs care in our state and also in our region. I think I'm like everybody, I wish we didn't have to have these mandates, but it seems like without them, people aren't sure what the best course of action is. And everybody will be impacted if we don't follow these instructions and restrictions. And what I want to say to people who want to defy them or think it doesn't pertain to them or that they can do it a safe way is that we don't have any evidence to know what the safest way is except for wearing masks and limiting gatherings. And please, if not for your own family or for your own self, for your community members, for the people that you love, I know it's a sacrifice and I know that you're tired. I'm tired too. But please, we can do this. We really can. And I'm hopeful that if we do this, we can look back in the spring and say, wow, look what we did. We really prevented tragic losses in our community. We do have room for more. They've actually done some things to, I think, reserve space. And our numbers have just increased pretty dramatically over the last week. So we're nervous. But you know, we have this whole contingency plan for how to house them. I know throughout the hospital that they are seeing more asymptomatic patients who are coming in and being cared for other issues as well, which just shows like the community spread is happening. If you don't see what we see, it can feel very abstract. I completely understand that. I just hope that people will listen and really hear that it is real, and you don't get to say whether your family is impacted or not. And just the range of people that we see, I think the message got out there early on that only people who were near the end of their life anyway, or near the end of their lifespan anyway, were dying from this, but it's just not true.